Some of these strategies may or may not be relevant to you depending on the stage of dementia. They may become more applicable as the disease progresses. First is to get the person's attention by approaching slowly, calmly, and from the front. A person with dementia may experience loss of peripheral and up and down vision, and so may only be able to see straight ahead. Therefore, it can be startling if you approach them from the side or behind. If the person is upset or emotional, it can help to establish a calm, caring atmosphere. Your calmness may help to settle the person. And use touch to get their attention when appropriate. For example, a gentle pat on the shoulder or forearm if they see you coming. So don't reach up and get their attention with a pat from behind. And call them by their name. Respect their status. Don't use elder speak. Ask the person if they would like your help. Position yourself to make eye contact by facing the person directly when speaking. This may require you to sit to be at eye level. Assess what their body language is telling you at this point. Is this a good time? Do they recognize you? Do they feel threatened or afraid? It's important to be aware of your own body language, such as gestures, facial expression, and posture. Bring the person to a quiet place. This is also referred to as setting the stage. People living with dementia may have a short attention span and have trouble filtering out other noises in the environment, such as traffic or other conversations. Remember back to the example earlier. Too much activity around an individual can also make it difficult for them to concentrate, so it may be necessary to move to a quieter place, or at the least, minimize background noise by turning off the radio, TV, and other distractions. Make sure the person has their glasses, hearing aid, dentures, those kinds of things. Pronounce your words clearly. Remember that the person's brain may be processing information more slowly than yours, so the pace of your conversation will depend on the person's ability and where they are at in the disease progression. A person in the early stage of dementia may only require greater enunciation, while a person in middle stage may require you to speak clearly and very simply. Do your best to match your pace to the person's ability so that you don't come across as talking down to the person. Be aware of your tone of voice. What is it saying about your emotions? If it might be communicating anger or frustration, can you take a breath and regroup before you engage in communication? Lower pitch, as is common with male voices, may be easier to hear, especially if the person also has some hearing loss. Higher pitch can be more difficult to understand and may signal that you are upset. Use short, familiar words and phrases. For example, if your mom grew up saying loo instead of toilet, asking if she needs to use the loo will likely be more familiar and easier for her to understand. Changes to executive functioning will also make abstract sayings more difficult to understand, such as, "The cat's out of the bag now," or "It's raining cats and dogs." Try to be as positive and reassuring as you can. You won't be perfect all the time, so do not be too hard on yourself if you have bad days. No one gets it right all of the time. Share one message or idea at a time. And break tasks into small, simple steps. You may have to allow the person time to absorb one sentence before moving on to the next. Do they understand what you're asking? Try not to overwhelm the person with too many choices. One or two choices maximum so that they have an easier time of choosing. Use your knowledge of the person, their likes and dislikes, to help you narrow down the choices. For example, rather than asking, "What would you like to do this afternoon?" you might say, "Would you like to do a puzzle together or watch tennis?" Show as you talk when you can. Use cues and gestures to demonstrate and clarify your words. Remember that it's possible for the person to have lost their ability to understand the meaning of words, but they may recognize the object or task if they see it. For example, if you're asking a person to sit down, point to the chair, and it may also be helpful if you sit down next to them. Use close-ended questions. Those are questions that have a yes or no answer. So instead of, "What would you like for breakfast?" you might ask, "Would you like toast for breakfast?" Allow time for response. Allow plenty of time. It may take a while for the person to gather his or her thoughts. Whenever possible, ask if the person would like help finding a word, finishing a sentence, or telling a story. They may be relieved to receive the help, or they may feel they want some more time to try and remember on their own. This is especially effective when the person has insight and can reflect on their wants and needs. It's more difficult when the person has limited or has lost insight and is unable to understand that anything is wrong with them. Listen carefully and respond to feelings, not stories. It's a wonderful phrase. For truly hearing and listening, we need to use our ears, our eyes, and our minds. Sometimes there's nothing you can do to solve the issue at hand. For example, wanting to go home when they're already home. Or sometimes what the person is asking for is not possible. For example, wanting to visit a family member who has long ago passed away. One strategy that might help in these situations is to validate the person with dementia's feelings rather than trying to respond to their requests or stories. The content of the communication doesn't matter so much as the feelings behind it. This is the key behind the term empathetic responding. For example, if someone says, "It's been a really long time since I've seen you," or worse, "You haven't been to visit me in months," it's more important to pay attention to the feelings behind the words rather than to the literal truth of what's been said. The feelings are always right, even if they are about stories that are not objectively real. The person may be feeling lonely and they're missing you. You may be the anchor in what feels like pretty stormy and confusing seas. Rather than launching into a defensive explanation of the fact that you were just there on Friday or yesterday or whenever, it's much better to empathetically respond with something like, "It feels like a long time to me too. It's really good to see you today." Or for someone who's wanting to go home when they are already home, rather than engaging in the, "Will you live here?" Ask them, "What is it that you're looking for?" Or perhaps you can help them to reminisce about something and get a sense of what it is that is prompting the emotion of wanting to go home. Watch for nonverbal cues, facial expressions, and body language. Do these match their words? If not, what might they be trying to tell you? And that ties closely into our next strategy, which is connect, don't correct. That is, don't argue. It's a lose-lose situation. Both parties will be frustrated and neither will be right in the end because the argument is taking place in two separate realities. A better strategy is to try and join the person with dementia in their reality as much as possible. While it's always best not to argue, this strategy will be easier in some cases and more difficult in others, depending on the nature of the thoughts or ideas behind the exchange. It may be easy to agree in some cases. For example, if the person is hallucinating and he or she is pleased by the kittens they see in the room, versus if the person is accusing people of stealing from them and is very angry and afraid because of it. In difficult situations, the right thing to say might be whatever works to comfort the person with dementia in the moment. Respond with empathy instead of facts. As an example, if the person feels that you forgot to tell them about a doctor appointment, it's better to apologize to them and acknowledge that they feel frustrated, their reality, rather than try to convince them that you have told them several times, your reality. You could say something like, I can see how frustrated you are. I'm so sorry I didn't tell you before. I thought that I had. But the doctor is hard to get in to see, and I'm hoping we can still go. Can I help you get ready? It can be very difficult to take the blame for things. It can help if you imagine coating yourself in an imaginary Teflon coat so that nothing will stick to you. For example, the doctor said that you have dementia, or the health authority has said that you need to attend the adult day program, or the Department of Motor Vehicles said that you need a driving test. The primary care partner can often be the focus of all the anger and frustration from a person with dementia. It needs to be a conscious discipline to push all the negative changes onto others and away from yourself. And this allows you to be the helper, their comrade, their number one ally. If you are having difficulty understanding, try repeating or rephrasing what they said and asking if you understood correctly. This may help the person further clarify what they're trying to tell you. You may also want to try rephrasing your own question, or you can try again later.